All right, so what's your take?
I think that clear aligners are kind of coming out of favor.
Oh, I actually strongly agree with you on this. And this coming from the clear aligner maestro.
Wow. In some circles, I guess, but yeah.
No, and now I'm wanting a play on Maz that is the maestro. Can we work on that? I don't know.
I like that.
We're working on it. So tell me more about this. Aligners are coming out of favor. Like, how do you see that?
So, we've been trying to push, I think, clear aligners a long time, and it seems like the pendulum is swinging back to braces here a little bit. So clearly clear aligners don't work.
No, I don't believe that. Now you're BSing me. You're pulling my arm. Well, obviously they work. I mean, they work in the hands of somebody who knows what they're doing. But you're being serious though about your opening point, right?
Well, I don't know. Am I?
No, I don't know. Are you? I've been a braces guy from way back. I've been 80% braces and kind of banging that drum for a long time. And I've watched your courses, and I think the world of you. And I apply your techniques to aligner therapy. But at least in my area, braces have always been more popular. And there's the patients that want aligners, but I don't twist anyone's arm to do aligners because then, they don't wear them. And
so it's interesting. I think right now, we've been struggling a little bit, right? In terms of a profession, I would say.
Okay.
And I feel like people are recommending them less and less. So why is that? It's interesting to me. I don't know. Is it because they don't work as well? Or is it the lab fee?
I think it's the lab fee.
You think it's the lab fee?
I think also there's a little bit of brand confusion. Like we used to have one brand with Invisalign. Now we got 5 or 6, and I don't know if that has something to do with it necessarily. But I think there's we got 74 brands, crazy, but I mean 5 or 6 big ones. I don't know if that plays a role, but I think there's something about once you decide the emperor's not wearing any clothes, maybe Invisalign. If you decided that, I'm not trying to be ugly, but and then you don't feel as compelled to use the other systems. You're not in the rat race to try to hit the status or something. I don't know. You tell me.
It's interesting. I think the trend's coming in too is some patients, clearly I think that reputation either from dentists doing it too much or whatever the case has been, that there's they hear it didn't work as well, So we're confident in what we do with it, right?
Yeah.
We know that we can actually make it happen. But it seems like the pendulum is swinging the opposite way a little bit.
Okay, so I'm going to seize any opportunity I can to talk badly about general dentists. So I'm going to take your take to be that aligners are no longer popular or as popular because general dentists have ruined it. I like that.
I would say that 100%.
Okay, let's camp on that for about 6 minutes if we can.
Let's do it.
No, but I think that's true. I think every patient now, it seems like, I say every patient, but a lot of patients, it's they get their cleaning, they get their hey, you got these cavities and you need Invisalign.
Worst feeling on earth is a parent in your waiting room wearing aligners that aren't yours. You know what I mean?
It's like sleeping with the enemy.
That's the worst.
This is no good.
It is terrible. And then
I want to start a law that we can rip the aligners out of the mouths of parents when their kids, or it should be you know what, your kid, we don't get to do treatment here until you change your aligners to my aligners.
It's quite insulting, isn't it?
It is insulting.
I mean, honestly.
What a slap in the face, we wouldn't notice, Well,
no, I call them out every time I see it.
Do you call them out on the specific attachments and how they're incorrectly placed?
I just look in the mouth.
This force system is garbage.
I haven't gone that far yet. Maybe I need to step my game up.
You need to start insulting the force system.
I need to do that.
I like the idea of that. Okay, so aligners are not as popular. Do you think that there's something to say about maybe Smile Direct Club and some of that direct-to-consumer stuff has hurt it, or?
That's hard for me to acknowledge, I guess. I feel like that actually did raise awareness to some extent about clear aligners, but obviously it didn't work well for people, right? So I think that maybe was a deterrent in terms of what they can do from an efficacy standpoint.
Okay.
But we did try to take those people in and help them out and retreat them as much as we could.
No, I didn't help them. They were on their own.
Did you? Yeah.
No, I'm not going to help somebody. Once you make that, you're dead to me. So you tried Smile, it didn't work for you. Yeah, you're on your own.
Remind me never to talk bad about you.
No, it's just I physically would push them out of my office. It was it would be raining and it'd be raining on them.
What if they wanted braces?
Not my problem.
Even so?
Not my problem. No, I'm very, very strict about that. No Smile Direct.
Did you see a lot of those people come through?
No, I'm just playing. No, I do whatever. I don't care. I'm not that serious.
I was like, wait a minute.
But it was funny to pretend, Anyway, all right. So let's end with this. Do you think there's a time coming where aligners become more popular again?
So I think the pendulum in orthodontics always swings, right?
It does. It's always swinging.
I think it'll come back to the future of the technology that's involved with it is going to change. I think clear aligners immensely, direct print and what that's going to do. maybe having less attachments, things of that nature, maybe having more memory or range in the aligner.
Sure, bring it.
That way it's more kind of forgiving if you don't wear it as much. Direct print, I think, is going to open up the Pandora's box for options with aligners in terms of what they can do. So I think it remains to be seen. You know braces work, right? You know braces work. Aligners work in the right hands too, and a great patient compliance-wise.
Yeah, sure.
So I feel like we're always going to have that push and pull, no pun intended, of like how it's going to work effectively, right? Yeah. And what we can do for patients with it. I think the future is going to be very interesting. We're in a precarious moment with clear aligners right now.
We are in a precarious moment with clear aligners right now. You heard it here first. I love this. This is great.
Awesome, man.
Thanks for, what are we doing? What are we even doing? This is wonderful. So the future, it remains to be seen, but we'll be here and we'll be keeping you updated on it. So fantastic Ortho Take from Maz Moshiri, everybody. Let's give it up. So great job. Thank you.